Hey, good evening, ladies. Hope you're all doing really well tonight. Make sure my volume's down as usual. Welcome to Wellness Wednesday. And a special welcome to all you new ladies who have joined us over the past few weeks, couple weeks. Maybe you're here for the first time for Wellness Wednesday. So, warm welcome to you. And let me go ahead and say my disclaimer while we wait for anybody else who wants to jump on and with us. Anything that I say tonight during this Wellness Wednesday is health information and not health advice. Don't start taking, stop taking, or change the way you're taking any of your medications. If you feel like you need to, please consult first with the person who prescribes those for you, and they'll help you make the proper adjustments. Attending this Wellness Wednesday also does not establish a doctor-patient relationship. So there we have it. All right, ladies, if you can imagine, I love puzzles. Every time I look at someone's lab results, it's like a brand new mystery to solve. Like, how many of you like mysteries? Like maybe Sherlock Holmes, Agatha Christie. I remember watching Murder, She Wrote with my parents when I was younger. I don't know how many of you used to watch that, but I used to love it. So that's me. Every case tells a different story. Some things look familiar from one person to the next, but the unique pieces are what matter the most, really. So tonight, for this Wellness Wednesday, we are going to go through a case study. And these are always the highlight of my master classes. And I think you'll see why. Now, speaking of the masterclass, I'm so excited. It starts Monday at 7 p.m. Mountain Time, 6 Pacific, 8 Central, and 9 Eastern Time. And it runs through Friday. Same time each week, each night, right? I always have so much to share. And that is why I usually add bonus videos with more information and tips at the end of the masterclass. And yes, you'll get if you register, okay, you'll get reminders in your email and texts, so there's no way you'll forget. And it happens right here in this group, just like Wellness Wednesday tonight. All right. We'll post the link also for the workbook when it's ready. So that will be pinned in the top at the top in the featured section. And ladies, you'll get the most out of this class if you join live. You can comment, ask questions, and connect with other amazing women. Women who deal with fatigue, they deal with brain fog and weight issues, but women who want real answers, women who are ready for a healthier life, like you, without constant symptoms, right? You'll also meet women who've taken the past classes, right? And they've become patients maybe, and they've seen incredible results. And you'll learn from their stories and their encouragement, right, ladies? Now, the support in this group when you attend live is amazing. So do your best to attend live. And if you can't, don't worry. We'll keep the first session up until the end of the weekend, so you can make sure you watch it before it's gone. Ladies, this is going to be a big masterclass. And inside, right here inside, this Fix Your Thyroid, Change Your Life group. So mark your calendar for Monday. Block out each day that week. This is that important. And if possible, arrange for, help with kids or grandkids. Come relaxed. Be in a private place and ready to take notes. Have your workbook or a notebook handy so that you can really just focus. This is you time. All right, now let's get on with the case study. And here's the truth, really. In traditional medicine, you get maybe 5 or 10 minutes, per visit, and you share your symptoms, and they run basic labs, and then you leave with a prescription. It's a pill for an ill approach, right? The disease and drug model. And the goal is to name the disease, right? But that name often just describes your symptoms that you're having. And the treatment is the same for everyone with that label. When the labs, match a certain pattern, they give you a certain standard treatment. There's no deeper digging, no looking at your unique factors. But here's the thing, every case is different. Yes, there are common patterns, but each person has their own unique mix of factors. That's why I use comprehensive testing. It's the only way to uncover the real reasons you're feeling this, the way you do. Tonight, I'll walk you through one case so you can see how I put the puzzle together. And the approach I take with patients and with anyone with symptoms is by asking one big question: why? Why is this happening? Where is it coming from? What's stopping this person from getting better? Why does it feel like they're stuck? Right? We have to really dig and deep to really find the root causes of the symptoms or the disease, don't we? I know this sounds, uh, like a new idea to some of you, maybe, because you think, isn't that how traditional medicine works? But the truth is, it really doesn't. For example, irritable bowel syndrome or IBS, right? It's a name for a collection of symptoms. There's a checklist like abdominal pain, bloating, diarrhea or constipation, cramping, irregular bowel movements. But they just group these symptoms together and call it IBS. So here's the big question: why do you have IBS? What's causing it? And what do we need to do to actually get rid of it? The name itself doesn't tell us any of that. And the traditional approach is to, might include things like, anti-diarrheal medicines or laxatives, antispasmodics, we call them, for cramping, or even maybe antidepressants or pain medications. But if you follow the drug therapy model, the name of the disease basically equals the medication. Yeah, everyone with IBS usually gets the same approach. And here's the problem: those medications aren't meant to reverse the disease process. They're mainly intended to slow symptoms, reduce discomfort, or cover up really what's going on inside. So when you don't address the underlying root cause, the problem doesn't go away. It can get worse. And over time, it can grow into more serious digestive or systemic issues like bowel cancers or autoimmune disease. So for me, I always start with the big question, right? Why do you have these symptoms? What is the underlying problem, or imbalance? What do we need to do to address it and reverse these issues? When you approach it like that, most of the time, the body can heal and the symptoms start to go away. Your body speaks to you. It starts quietly and then it gets louder and louder and louder until it's basically screaming at you, right? Hey, you've got to figure this out. I'm not functioning here and I'm not happy. So we keep asking, why do we have these symptoms? Why is this disease process happening? And what do we need to do to guide the body back to healing? Your body can heal itself, and you still have the power to heal. But sometimes it needs just a little nudge, a little help, right? Sometimes the environment around it isn't supportive and it can't heal on its own. So we have to look under the surface. We have to understand what's really going on and figure out the correct path forward. So tonight, I'm going to go over the typical blood work I use when evaluating someone who is as a potential patient. And, we do other tests too that help even more, but we don't have time to cover everything, all right, tonight. Here's what I want you to think about, though. Number one, have you had all of these tests? Number two, do you have symptoms? And we need to dig deep to figure out where these symptoms are coming from. I also want you to understand this. If you have symptoms or a disease that you've been struggling with for years and you haven't had these tests done or had them analyzed from a functional medicine perspective, there is still hope. So many of you start to lose hope. You go from doctor to doctor expecting a different result. But all those doctors, they often have the same tools in their toolbox, the same, medications that are supposed to help. When those treatments don't work, which is so often the case, you have to look for a different solution. And when you choose a different path, you can get different information, right? And then you can expect different results. Okay, so let's get to the blood work. Okay. Oh, and just let me give you a little introduction. This lovely patient, she's 66. She was dealing with a lot of fatigue. She had no motivation to clean her house. Took a lot of naps in early evenings and still went to bed around 7:30. She had brain fog that she described as blinking out and was super distracted. Now she felt depressed, had menopause symptoms, like drenching night sweats, heat intolerance, irritability, especially. Now, let's see, her skin was dry, scaly, hair was thinning, and she had restless legs and cramping at night. So she didn't sleep well. She was concerned about her heart and had had a catheter procedure done prior to attending the master class. And she was concerned about prediabetes. All right. So let's share the screen and we will show you what's going on. Okay, so I forgot to restart the app because I had to make sure I could share it earlier. Here it is. Okay, I just want to make sure it's big enough and we'll get there. Okay. Now I'm going to make it even bigger, so hang on. So this is what we need to look at. And it ends up being that it's not clear at first that she has Hashimoto's because we always look for that. But we're going to talk about what we do find. So right now we're thinking that she has functional hypothyroid. She has a lot of different stuff going on. And we're going to start right here with the hematocrit, which is the concentration of oxygen, oxygen carrying capacity, hemoglobin in the blood. All right. So hers is high and it typically means dehydration. So when you heard me say she had dry skin, this is definitely one reason why. Her MCV was high. Uh, Actually, I want you to, if someone can let me know if you can see this big enough or not. It's really as big as we can get it. I, yes, and if you can turn your phone sideways, you should be able to see it a little better. Okay, so let me make that window just a bit bigger. Okay, I'm being told that it's all good. Okay, good. So MCV, mean corpuscular volume, the volume of your red blood cells. She's a little big there. That can cause some circulation issues. This can also mean that it's going to be difficult for her to detox because she's lacking activated B vitamins like B12 and folic acid. Now, we always need to look for infections, hidden infections, because these cause inflammation. And when we're talking about trouble losing weight, that was the other thing. Sorry, I forgot to mention. She was tired of trying to lose weight. She really wasn't having luck there. And she really had exercise intolerance. She was not, and being dizzy as well. So she really had a difficult time exercising. All right, so hidden infections. We see the lymphocytes are your virus fighters. And so there's this viral pattern of infection. These tend to cause chronic stress on the immune system. Monocytes are the first responders and indicate an active infection when they're over 5 or 6%. So at 8%, surely she's dealing with an active infection process. Just don't know where it is yet. Now, this is interesting. Eosinophils are the parasite fighters. So she has a parasite pattern of infection too. Anytime these are 3% or more, we really know that someone's dealing with a significant parasite issue. All right. When there's a weight issue, when there's an energy issue, all right, there's almost always a blood sugar problem. Her glucose, fasting glucose, is slightly in the dysglycemic, or let's say dysfunctional range. So super optimal is between 80 and 90, and she's at 93. So we're going to have to dig a little deeper to see if there's really a blood sugar problem, right? She was concerned about her kidney function after we talked because her GFR is not optimal. Optimal is 90 to 120. And so she's at 83, and she's decreased some with her kidney function, which is not a treatable problem in medicine. There's no pill for this. The only thing doctors can do is watch it, wait till you get to the point where you unfortunately need dialysis when it gets that bad. Now, this is interesting, and it plays into the memory issues, the the blanking out, the brain fog, sluggish movement. So she's got a sodium of 139, potassium 4.2. These are all normal. Chloride 101, carbon dioxide 21. But I'm going to pull up this little note, and I don't know if you can see those little numbers there, and I wish I could make it bigger, but it says that she has this anion gap. So we add 143, the first two, and that's 143.2. Subtract the second, the last two, minus 122, it's 21.2. This is called the anion gap. This should not be more than 12, ladies. 12. This means that she has a major electrical issue, meaning a discrepancy between her electrolytes. This will cause blood pressure issues, for which she is on blood pressure medications. This will cause fluid imbalances. It accounts for the dizziness when she gets lower pressure sometimes, and then she gets dizzy or lightheaded and gets off balance. All right. This causes brain fog. It's like your spark plugs are gap too wide. How many of you know what happens when your spark plugs are gap too wide? You misfire, right? Do you think she was misfiring when she blinks out? Absolutely. So this is an adrenal problem, right? Because their adrenals aren't making those hormones that balance the electrolytes. All right, let's explore this blood sugar problem just a bit more, and a liver issue. So she's got two liver enzymes that are above 19. That ideally, they should be between 10 and 19. This indicates liver stress and is a sign of fatty liver disease. It's part of that pattern. She didn't really know she had fatty liver, but we're going to explore onward and upward. Triglycerides over 100 indicate fatty liver as well as insulin resistance. So now we're starting to see a pattern emerge. And then total cholesterol's sky high. I should have highlighted that one, but it's adding up all of these HDL, VLDL, and LDL particles. So it's not good when HDL is over 80, over 70 even. It indicates autoimmunity, and it indicates a gut infection. So, we're thinking about those parasites now. Maybe a bacterial overgrowth. Now, LDL, these are transporters for cholesterol and are not the cause of anything. Now, she was, of course, concerned about this because of her heart issues. So I reassured her and I let her know, look, these are symptoms. This high cholesterol, this high LDL and high HDL, and these are symptoms of a few things going on, symptoms of your cells being sick. And this is caused by liver dysfunction, insulin resistance, and low thyroid. Okay. So we look onward and we see, I'm not going to spend too much time, but this HLA-DR test does indicate for her that she is genetically mold susceptible and susceptible to Lyme disease, chronic Lyme disease, if she were exposed. So that's what her genes here mean. And I would show you a website. It just takes a little more time than we have tonight. So let's look for this dysglycemia, and I'll come back to this thyroid part. All right, so hemoglobin A1C, she is in the pre-diabetes range. So she was concerned about this. This means that her blood sugar is higher on average, and she's insulin resistant, becoming even more so. We look at, let me skip down here. We look at C-reactive protein. This occurs because of excess insulin and other things that cause vascular or systemic inflammation. This cardiac risk marker, when it's above 3, indicates that she is in fact at high risk for a sudden cardiac event. Not just developing cardiovascular disease, but actually at risk for having an event, like a stroke. And so ideally it should be under 1. Okay. Now, this is again caused because of insulin resistance and dysglycemia. LDH, this is part of that fatty liver pattern again. Lactate dehydrogenase is an enzyme. When it's above 180, this indicates that her liver is starting to scar already. And she has fibrinogen activity. This is a clotting factor. When this is above 369, but especially above 425, she is at high risk for blood clots. So couple that with that C-reactive protein cardiac marker, and she is really at high risk for a sudden event. Now, insulin, fasting insulin, this should be below 5, well, so between 2 and 5 optimally. So when you're above 5, you're more resistant to insulin. You're certainly storing more fat. This is why she was not able to release the weight. She had a goal of releasing about 40 pounds from where she was at about 160, 165. And she's not that tall. But now we see why. We see that her insulin is higher in a fasting state than it should be. Imagine what it surges to when she eats a carbohydrate-rich meal. So pastas, cakes, cookies, juices, even fruit. Because with fatty liver, especially non-alcoholic fatty liver, fruit is going to cause more issues for developing that. And so we know she's developing insulin resistance. This also increases her risk for cardiovascular disease and stroke. And then we see, let's go back up here to the thyroid and see what kind of problems she's having there. So I don't see the antibodies. I don't see positive thyroid antibodies yet. Okay. These don't tell me they're 0, and they really should be 0. They just say less than 9, less than 1. So keep that in mind, and there's a high false negative rate. So with her thyroid, her TSH is high. It's functionally high. So not quite out of the lab range, but doctors like me who know how to put these puzzle pieces together don't even like this over 2. Most doctors and endocrinologists actually, might get concerned if it's over 3, but I get concerned when it's over 2. It really should be around 1, 1.5, and that's it. So she's at 4.2, indicating she's likely hypothyroid. Well, let's dig deeper. She has normal levels of T4. So is she hypothyroid yet? Let's see. T3 uptake. So this ideally should be 30 at least. If you look at the range, should be at least 30 up to about 38. So she is lower than that. This indicates her tissue availability or capacity for binding to T3, the activated thyroid hormone, T3, is low. So she's functionally hypothyroid, and it shows her TSH is in fact a little high. And so her free T3 is low at 2.8. It should be ideally over that, 2.9, 3 at least. So the active hormone that works in your cells, in every single cell, is not working really well for her. Okay. And so she's got hypothyroid, functional hypothyroid. Now, DHEA was up here. There we go. This is part of that adrenal deficiency, of adrenal dysfunction. We learned from her saliva test that she had higher cortisol levels at night. So she wasn't sleeping great, probably because of pain. And when your adrenals are making a lot of cortisol, or your stress hormone, for years, they're going to more and more get into this dysfunctional state and not produce enough DHEA, which is the functional building block for testosterone and estrogen, the sex hormones. So this should be at least 275 by the functional medicine data. Okay, not this range doesn't really cut it at all. It should be at least 275 up to about 360 or so, 390, something like that in women. And she's at 60.9. So she's not going to be able to repair very well, because this is a repair hormone. And she's not going to be able to make a lot of estrogen and testosterone, which can put her at greater risk for osteoporosis, Alzheimer's, dementia, heart disease, right? Put her at greater risk for losing muscle, just getting weaker and weaker, which she really felt like she was doing. All right. So let's go to and point out a few things that have improved for her. And we'll start by the eosinophils. The parasite fighters were lower. This was a few months into her treatment, so these were lower. Her glucose is correcting. All right. She was concerned about kidney function. Now it's completely normal. Her GFR rose to 102, completely optimal now. Triglycerides dropped from over 100 down to 53, and that the LDL is decreasing. It's still a little high, but like I said before, this is not the cause of anything. And she's still working on getting, her cells fixed. It doesn't happen overnight, ladies. It's a process. And so at least it's lower, right? It's moving in the right direction. Now her TSH is much better. She's in the optimal range for that. Still making good T4. T3 uptake is much better. It was at 25. Now she's optimal. So she's really getting that T3 into her cells. And let me just skip down here to the T3. It's still a little low, but in this context, because the tissue availability is so much better, this makes more sense, and it may be less in the bloodstream and operating more in her tissues now. So it's all about context. Her hemoglobin A1C is now much better. It was 5.8. Now she's not pre-diabetic anymore. And her C-reactive protein decreased significantly, is now under 1. That means that she is no longer high risk for a sudden event. You better believe she was happy about this, right? Because now her risk is low. LDH is improving, indicating that the liver isn't damaged as much. You see, ladies, when you take the right approach, you can reverse this fatty liver process, even when you've started to scar, where she was when it's over 180. Now she's just barely lower, so she's going in the right direction. Still doesn't look like she has Hashimoto's, so that's good, but it's, still a question. Fibrinogen activity, much better. All right, now it's within optimal range, and she is at much lower risk for having a blood clot and a heart attack or stroke. And her insulin, it's a lot better. indicating, and this is why her blood sugar is a lot better. She doesn't have to produce as much insulin because she's changed her diet and she's getting less and less resistant to insulin. Let me show you her. So this is Nancy, all right? This is her before, and this is Nancy after on the right. You know, what an amazing transformation. She's off all 4 of the medications she was taking now. She no longer naps and has energy into the evening. She said she sleeps 7 to 9 hours nightly now. And her memory's much sharper. She doesn't blank out during the conversations. Her energy and motivation have returned, and she can take care of her house and so much more now, even getting back into her hobbies. Skin is much better too, and her hair's starting to fill in and thicken, she said. She's got 10 inches off her waist. She's released 40 pounds, even more than she thought she could. So, ladies, I wanted to show you this case study. Sorry, one second. Oh my goodness. I wanted to show this case study to show you what's possible. Okay. She, she had to become her. Well, let me give you a couple of takeaways, right? First of all, she felt terrible, right? She had almost every symptom that so many of you have. She kept going to her doctor every 3 months. Do you think they looked at her liver? They ran the labs, the basic labs, and just kept telling her everything looked fine. She she couldn't lose the weight. She was tired all the time. Some days were, so bad. She couldn't make plans. She couldn't trust that she'd have energy to keep them, right? Because the way she felt. So key takeaways from tonight, she became her own advocate, right? Are you your own advocate? Were her doctors checking for the right things, like her liver? Were they, how long had that been going on for her? She had to take responsibility and get the right tests when she had the chance. And so she did take responsibility. Remember, the word responsibility means the ability to respond. And if you're not making progress, if you're still having symptoms and you're still suffering, you have to do something different. Because when we don't, today becomes the same as yesterday was. Tomorrow becomes the same as today. Weeks turn into months this way. Months turn into years. How much time are you wanting to lose? Many of you have been dealing with these symptoms for decades. And so I encourage you, start becoming your own advocate. Ask for those blood tests. Ask questions. And if a lab value looks high, ask what it means. Lab results aren't random. They do mean something. I do have to mention this. Look, I know many of you are frustrated because you have to ask for extra tests and your doctors tell you, well, insurance won't cover those tests. And insurance doesn't always cover them because the truth is their job, insurance job, is to make money for their shareholders. That's it. They don't want to run tests that don't change the treatment because it costs them money. So in the drug therapy model, if a treatment is always going to be thyroid hormones, running extra tests, even checking for antibodies for like Hashimoto's or Graves, doesn't change what they give you. The insurance company says it's unnecessary. It's not medically necessary, right? Because in their world, if there isn't a drug, it's not needed. When we look through functional medicine lenses, right? All of this testing is necessary. The information we gather is absolutely necessary. So it's going to change treatment. Even Medicare's guidelines admit that if a treatment is meant to reverse disease or improve quality of life, it's not medically necessary. It's exactly what it says. That's a sick care model. It's not a health care model. Health is preventing disease. It's reversing disease, even putting your body into optimal function. Another takeaway. I hope you've restored some hope tonight, right? Don't give up. There are answers. If you have a symptom, there's an imbalance. You just have to figure out what it is, right? And that helps you find the solution. All right, next week in the masterclass, we're going to go deeper. We'll explore why you can't lose weight. We'll explore the mental blocks that you might not even realize are holding you back, and why some people gain back the weight they even, when they lose it. We'll dive into more case studies so you can understand what's happening under the surface. Make sure to join me Monday through Friday. You don't want to miss it. I love seeing so many success stories as well. Some of these women are my patients working, through their root causes. Some are not patients. They just attended the master class and they've implemented what they learned. And guess what? They're losing 10, 20, even 50 pounds and turning their lives around. So make sure you attend the master class live. Arrange your schedules so you can be focused and ready. And ladies, if you're new to the group and have questions, reach out to Cherry Ann, our masterclass concierge. You can DM her or text her at 208-842-4466. Okay? She'll help you with anything you need. Now remember, the masterclass runs from the 18th through the 22nd, each night at 7 p.m. Mountain Time. Now, if you're not registered yet, Cherry Ann put the link in the comment section. So registering gives you email updates, reminders, and text alerts so you don't miss anything. All right. I think I can take a couple of questions, and I think there are a couple. So let me see. What is used to help the cells get back to normal? Okay, well, there's so much that we have to do to help the cells get back to normal. It's changing the way you eat. It's making sure you get the right nutrients. It's getting the right supplements for what we see in your testing that you need. It's really customizing your care. And we'll talk a lot more about that as I explain the blueprint for helping your cells heal during the masterclass, right? I explain my blueprint in its entirety. What's the other test for your liver? My doctors do nothing. There are many tests for the liver. In fact, most of the metabolic panel, well, half of it, let's say half of the metabolic panel, checks liver enzymes. So alkaline phosphatase, bilirubin, those AST and ALT enzymes, lactate dehydrogenase, which is not one that doctors typically get, right? They don't talk about that because there's no treatment for fatty liver disease. There's no pill for this, and they just have to watch it. They are counting on your liver outliving you. And so when it doesn't look like it might, if you're sick enough with the liver and you're young enough and healthy enough, they'll put you on a transplant list. But that's all that can happen. All right. There's ultrasounds or CT scans, of course, when you do have things that look very, very abnormal in the blood work. But until things look, until they're actually high, above or below the standard ranges, doctors aren't going to really do anything differently. And even if they do test you for fatty liver, what are they going to do? Again, there's no pill for it. So oftentimes they have to find another reason to scan you than to look for fatty liver. That's how ridiculous this is. The question is, I'm a little worried about HERX symptoms within the detox protocol. Is there help with that in the program? If you are having some of those HERX symptoms, please understand, excuse me, they're annoying typically, but they're not typically dangerous. If they're just mild, try to get through them, but talk with your provider, your coach, and you may need a little more liver support, right? You may need more binders, more chelators. So if you have other questions, if I imagine this is coming from a patient, reach out to me as well in the app. No problem there. I'm happy to answer and guide you, and make sure you do reach out to your coach and your provider. What is the cause of oversized red blood cells? Missing certain vitamins, especially B12 and folic acid. That's a big one, right? That's typically why they're too big. And so if you're missing those vitamins in your in your diet, if you're not taking enough in supplementation, then that can be a problem. Part of that can be parasites steal those vitamins too. Okay. Questions keep coming. We'll take a couple more and just go on just a few more minutes. Has anyone here suffered from scalp tenderness? I'm still trying to figure out what this is a symptom of. Well, that's a good question. Scalp tenderness can be where your skin itself is tender, and a lot of times there are infections, hidden infections that you could be dealing with. You could be dealing with some autoimmunity there. You may not notice necessarily hair loss that's patchy with alopecia areata, but you could have things like psoriasis that can be causing that scalp tenderness. The scalp is it is full of a lot of nerve endings. So it's, yeah, it's possible that anything like that can cause some of that tenderness. Can be underlying muscle tension, can be scalp tenderness. There's a lot of muscles that run the length of your cranium, your head. And when you have tension, and a lot of times you'll notice this, especially if your neck is tight as well, that'll tighten up all this, pull your head, tighten up those muscles, really cause tension around those muscles in your head. And so most often that scalpel tenderness is due to muscle tension. Another question, I have Hashimoto's, does it affect iron? I wouldn't say directly. I wouldn't necessarily even think of an indirect. This is mainly due to you're not getting enough iron necessarily, or you've got infections. You maybe have iron overload or too much iron storage and ferritin, which would trigger the Hashimoto's, but wouldn't necessarily be from it. Okay, ladies, I think that's it. I, probably want to, we've been on here a while, probably ready to rest, go get a good sleep tonight. I'll leave you with all of that, and have a great rest of your week and weekend. And I'll see you back here Monday for the masterclass. Good night, everyone.